For our listening audience, one of the things that you heard from me already is that fat is not bad for you. Bad fat is bad for you. So, Dr. Perlmutter, what types of fats would be good fats to consider in the diet?
Always an excellent question. And I do digress, I guess. I didn't realize I did, but I do. Let me start with, again, the importance of fat, and we'll talk about good and bad fats. So fat is a fundamental player as an energy source in human physiology, but beyond that, it is a fundamental structural component of really every part of your body, but most importantly, the membranes of the cells, and some of those cells happen to be nerve cells. The membranes are made from fat. Healthy cells require healthful fats.
For our listening audience, the membranes are the walls of the
exactly.
cells.
Well, the walls, I guess, not exactly a cell wall, but that's correct. So that said, the cells, your brain cells, your body cells, are constructed from the fats that you elect to consume. Now, when a person is consuming very highly modified, long shelf life types of fats that you find on the grocery store shelves that are there month after month and have been modified in such a way that they will not go rancid, those are dead fats. They're damaging fats. They'll destroy the brain, and it's really what we need to absolutely avoid. The good fats are the wonderful monounsaturated fats, fats like olive oil, coconut oil, avocado, wonderful fatty food, even grass-fed beef if you choose to eat beef, wild fish as opposed to farm-raised fish, nuts and seeds, wonderful fats to add to your diet every single day. And you know, the main pushback I think that people experience or conceptualize in terms of these recommendations of improving or increasing your fats is, first, recognize that pretty much everybody has about 35% of their calories from protein. So the variables here are either a low-fat diet, which became popular in the early 1990s, at which point diabetes rates exploded, or a high-fat diet. When a person goes low-fat, where do you fill in those calories? You fill them in with carbohydrate. If you're high-fat, then you're cutting back on your carbs, and I absolutely favor that. And it's not just, Tom, that you have me on as a guest today and we're talking about what are my preferences, and you wonder why. I mean, here I am a guest on this program, and where did I dream this up? Well, you know, there's a whole paleo movement that attaches itself to a high-fat, low-carb diet for a number of reasons, but I think it's really relevant that we go back and look at what is the peer-reviewed science telling us about what is really best for human physiology. The main pushback for people eating high fat is they somehow have this perverse idea that this is going to cause heart disease. And nothing could be further from the truth. People say they're going to go on a low-fat diet because that's going to help them lose weight. And again, nothing could be further from the truth. The science doesn't support that. When you look at what was published in the New England Journal of Medicine back in 2008, there was actually a study called Weight Loss with a Low-Carbohydrate Diet, Mediterranean Diet, or a Low-Fat Diet. Head-to-head competition. Let's look at the science and see what happens to people. They took 322 moderately obese adults, average age 52 years, and they put them on one of these three diets, low-fat, low-carb, or Mediterranean. And obviously the extremes were the low-fat versus low-carb. Low-fat is really the diet du jour. It's what everyone's telling you to do. Just last week, former President Bush had a placement of a cardiac stent. And when the program, after the segment was aired on national news, the media advisor for the national network said, once again, what we really need to emphasize to people is they've got to lower their carbohydrates and absolutely reduce their intake of dietary fat. That's not fair because it's not based on science. It's based on mythological information that comes to you courtesy of people who have interest in making sure we eat a high-carb diet. So if you're eating low-fat, you're eating high-carb. Let's go back to the New England Journal of Medicine study. What they found was in the 2 years when you compared the low-fat versus the low-carb diet, those who had who ate low carbohydrate had a dramatic and a significant increase weight loss and kept the weight off much more aggressively than the people on a low-fat diet. The HDL, or so-called good cholesterol, went up dramatically in people eating lots of fat. The triglycerides are a powerful marker of risk for cardiac events. The triglycerides dropped 23.7 points in people eating a lot of fat and low carbs. 24 points. In people on the low-fat diet that doctors will tell you to go on for triglycerides, the triglycerides went down 2.8 points, 1/10 of what they went down in people eating a lot of good fat. Fasting insulin was far better in individuals eating lots of fat, as you would expect, because they're cutting back on their carbs. LDL, or bad cholesterol, reduced by 3 points in people eating a lot of fat and not even anything statistically significant in people on the low-fat diet. So really across the board, and perhaps from my perspective, most importantly, what improved so dramatically in people eating a high-fat diet was that their C-reactive protein went down dramatically compared to people on a low-fat diet. And that gets back to exactly what you asked me in the first place. What is the importance of inflammation? Now, C-reactive protein, for your listeners, is a blood test that many doctors perform because it's a marker, a blood marker of the activity of inflammation in our bodies. The higher the C-reactive protein, the higher is this process we call inflammation. And having said that, this study, published in probably, arguably, the most well-respected medical journal on the planet, showed in an interventional trial, in other words, where they gave people something, diets to stick to, showed that the best diet to reduce inflammation is a high-fat, low-carb diet. Inflammation is the cornerstone of coronary artery disease and Alzheimer's, and obviously any number of other problems. So again, it's great for us to talk about, people's ideas, but I think it's really far more important that we go toe-to-toe with what people are being told and look at what is the mainstream science telling us, the best well-researched studies are telling us about what we should be eating.